We are here with Dr. Patti Robinson, clinical psychologist and pioneer in primary care behavioral health. So we are really excited that you're here so you can answer some questions for us, considering you've been really kind of thinking about this for decades and kind of been a huge part of your life work.
Yeah, thanks.
Excited to pick your brain.
Yeah, thanks for the opportunity.
All right, so would you want to maybe explain a little bit about what is primary care behavioral health and some strategies?
Yeah, well, I see primary care behavioral health as a model, but it really does. I like your word, strategy. It comes down to a number of specific strategies that most clinics can implement. Maybe not all at once, but together, kind of to build behavioral health integrated care in their clinic.
What do you think are the top strategies to get started with?
Well, first is to get behavioral health providers that are trained to work as primary care providers. So that takes a lot of kind of retraining. You need providers that can be generalists, providers that know the evidence for behavioral science and particularly brief interventions, and that like to work in a team situation and kind of share care and inform care. So the consultant skills are really important. And then the accessibility. So one of the most important strategies is having same-day visits throughout the day in the scheduling template of the behavioral health provider.
Yeah, and a lot of the feedback from other BHCs that have set up in different systems is how much the primary care providers love that on-demand aspect of PCBH.
Yeah, and patients like it when, for me, when I want help, I want help.
Yeah.
I don't want
6 weeks from now.
Yeah.
Or, that's if we're lucky, right?
Yeah, exactly. So I think we see, and we're seeing studies come out now that document that in this model of care, in this approach, using these strategies, we're able to reach probably twice as many people at least as we did when we are using other strategies. So that's pretty good.
Yeah.
That feels pretty good. I guess one other strategy I think is important is having a behavioral health provider on your team in primary care who is really seen as a subject matter expert and has teaching skills. So in very informal and just at the moment of need, can educate the primary care team on behavioral science because historically they've been light on training in this area in their training programs.
And considering it's a huge part of the work that they do,
yeah,
it's a kind of a perfect fit.
Absolutely.
All right, so with this strategy, this model being so important to you, certain challenges that tend to come up with it?
Well, I guess the first and foremost is probably just training, because it's a lot of retraining for behavioral health providers that are already in the field and that are moving into primary care. And it's training, I think, that requires that we not just give people a course or, an internet-based training. All of those are really important. Of course, reading books, I'm a big fan of. Read a lot of books.
Written a few.
Written a few. But also training on the job.
Yeah.
So it's a challenge to get the training to the people that are going to build this thing.
I see.
Get it in a timely manner so that they are successful and have the skills they need to implement the strategies. I think one of the mistakes I see healthcare systems make is they hire somebody and then they train them minimally and then they wonder, kind of why didn't it work a little better.
Yeah.
So I have come to thinking in terms of train the leadership in the clinic first. Train them in the strategies. Let them think through their operations and how this would impact operations, and then kind of like set it up.
Yeah.
And create that foundation. So I'm working increasingly with leaders first. In fact, I have an article coming out on preparing a primary care workforce, and we really talk about leaders.
Yeah.
And have a leaders PCBH core competency tool. So these are the things that leaders need to be able to do and understand and work with before you really go in and start into transformation to fully integrated behavioral health care.
So get leadership on board and then make sure that we're giving full training to the BHCs who are going to be doing this work.
And to the primary care providers.
And to the primary care providers.
Yeah.
Really.
Jeff and I put a core competency tool in for primary care providers in the second edition of behavioral consultation in primary care, because we need to be systematic in training them. I think at first we would just kind of train them on the fly, but we need to train them in that
intentionally and directly.
And the same thing with other members of the team, such as medical assistants, and some systems have behavioral health consultant assistants.
Yeah.
And we need to train them. So we have core competency tools for all of the people involved.
Now, what would you say for some individuals who feel like, a PCBH just isn't right for my population, or it's just not right for my patients, as far as, is there more flexibility?
Oh, well, I do. I think I know what you're talking about. It's like sometimes people will take the PCBH manual template and try to just kind of like, nope, it's this, and there's no adapting it. I think we need to adapt. We add in some strategies, or we kind of bend other strategies depending on the population. So an example of this might be working with clinics that are working with trying to serve the needs of people that are homeless. And there, I think we have a lot of opportunities to really implement the model flexibly. And I don't know, one of my favorite medical directors of a homeless clinic in San Francisco, and he, for example, said, well, we need 2 BHCs to every PCP. So
wow.
That's kind of really shifting the model in a significant way, but I think it's an important way.
Yeah, so generally speaking, it's more like 1 BHC to 3 to 4 medical providers. But in this case, depending on the population, you can make that switch without losing the philosophy that's behind it.
Right.
All right. And so opportunities for what PCBH and integrated primary care can bring. Where do you see the opportunities being?
Well, the opportunity that kind of started me in this work and continues to motivate me today is the opportunity to get evidence-based interventions to more members of the human race.
Yeah.
Because the system we've had has really failed to reach so many people, and suffering in the world continues to grow. So it's that ability to take what we know that works and shape it so that it's a primary care service and it's very patient centered, patient friendly, accessible, and kind of pared down to the amount of time that most people are willing to spend. And then to test these kind of pared down, adapted versions of evidence-based interventions, and to just in the first place, a huge opportunity just to develop randomized controlled trials that test brief interventions for primary care.
Yeah.
Rather than these big, university community-based samples. So I think I'm working as a consultant on a grant with Katie Kanzler's the PI right now, and she is evaluating a acceptance and commitment therapy intervention delivered in a group format by a behavioral health consultant. And it's being, of course, given the urgency of the situation with persistent pain
Yes.
and the opioid epidemic, it's being compared with enhanced usual care. So patient education protocols that use the evidence we have from CBT,
Yeah.
kind of in small doses. So I love research like that. It's like, let's put everything we have out there
Yeah.
and see how it works for him.
Yeah.
And
So we
improve the healthcare. I think, that in essence is the opportunity is to really transform healthcare.
Yeah.
And to make the money we have to spend to improve the health of our communities, our country, make it well spent in a way that kind of reaches a lot of people and feeds the souls, really, of the people that delivered this care. So they can see people getting better. They do know what to do, and they're not stuck kind of trying to, go with a medication and, because it's what they have time and training to do. So there's just huge opportunities.
And that's another theme that I think that everybody's heard through this talk is just getting it out to the masses and getting evidence informed interventions, get it tested, get it out there, and to be able to reach as many people as possible is really kind of the heart of the mission.
Yeah.
All right.
Yeah.
Well, it was so wonderful hearing from directly from, again, a major pioneer in primary care behavioral health, and written two kind of the Bibles of primary care behavioral health, the first edition in 2006.
Yeah.
2007, one of the two, and then just recently the second edition just coming out. So definitely that has a wealth of knowledge in there, both of those books. So definitely recommend those. And we really thank you for talking with us.
Okay, thank you, Bridget.
Alrighty.
Nice. Yeah.